We have all felt the stress of the pandemic, whether it's from losing a loved one to losing a job or just trying to make sense of it all. Our children are feeling it too, and it's showing through some startling statistics. Here's KQ2's Alan Van Zant with what health experts are saying about kids' mental health during the pandemic.
It's one of the hidden casualties of the COVID-19 pandemic. In addition to the more than 600,000 Americans who've died from the virus, there's also been a significant uptick in teen suicides. The CDC says there was more than a 20% increase in ER visits from potential suicides by children 12 to 17 last year over 2019. And last winter, the increase was 40%. Child behavioral health experts say kids have not been immune from the stress of the pandemic.
When kids lose the routine, lose social support, if parents are having financial instability due to the pandemic, that stress does kind of trickle down to kids.
The St. Joseph School District is aware of the extra stress teens are facing. They've increased staffing for student behavior, now with 50 counselors across the district to address trauma.
We understand that we need to be able to help address the mental health issues of students as well. Our primary goal is education, of course, but to be able to help kids to focus, they need sometimes to have that additional support.
The numbers from the CDC also show suicide attempts from teen girls have been even higher, up 50% this past winter over 2020.
Girls tend to take things to heart and sometimes wear their heart on their sleeves, and so they're more likely, if someone is possibly being mean to them or if something's happening in their family or that type of thing, to just to react to that more emotionally.
Most child health experts say it's important for kids to be in school. And when kids are learning remotely, they say they're losing out on one of their biggest safety nets for human interaction.
The only way that they could interact with them in many situations was through social media. They couldn't see them face to face in school when we weren't able to be in school, or if they were in virtual school, they wouldn't see them face to face.
But they add that parents always need to be the first line of defense in their children's mental health and be ready to ask tough questions if needed.
Are you having thoughts of not wanting to be alive? Are you having thoughts of wanting to kill yourself? I think we get scared to ask these questions because the answer can be scary. It would be hard to hear our child say that. But we have to know so we can then intervene and get them the appropriate care that they need.
And that was KQ2's Alan Van Zant reporting. If you believe you or someone you love is considering suicide, call the National Suicide Prevention Hotline. Their number, 1-800-273-8255.